So let's start with you guys telling us 313 COVID. What is that?
At the start of COVID, the coalition of partners really came together very quickly to understand that in order for parents and families to gain a better understanding of what was happening, that the information should be coming from trusted sources, community partners, next door neighbors, after school programs that their kids attend, because they were much more likely to receive that information from those trusted partners, unfortunately, than they might from the normal talking heads from, those that are coming from the city or from the health department. So that was really the call that brought everybody together, was how do we ensure that our parents and our students had the right information coming from those talking heads, but coming through trusted partners in an avenue and through a vehicle that they will be most readily able to receive.
Yeah. And Christine Bell, these virtual meetings you guys have been having, these neighborhood town halls, are really impressive. 75,000 people have participated. It really is indicative of how hungry people are, not just for information, I think, but for interaction and for contact around this issue. I mean, it's such a personal issue with everybody, and we all want to connect to talk about it.
Yeah, I think that I also think that the format that we put forward is one that engages folks. So I think the trusted partner piece, I think, is really important, but as trusted partners, we also brought the people that know the most about whatever topic we're talking about. And initially it was really around education, but we've now talked about what is behind the slogan of defunding the police, and the science behind why we were staying at home. We've brought a virologist on. So it's really bringing the experts. But then another piece of that I think has been incredibly important and valuable is everyday people can ask questions of those people. And so when Dr. Vitti is on, anyone can ask him a question, and we're not filtering any of that. And I think we've also not been afraid to ask the really hard questions. And I also think that the leaders that we've brought on have not shied away from answering those or saying that they don't know. So it's a very human experience, I think, as well, when you get on and you're able to interact as equals.
Yeah. Terry, the Skillman Foundation's work focuses pretty intently on our children and their well-being. Talk about how this initiative lifts up the experience of children during this, and the things that we need to be doing to help them make it through.
The one thing that I found, and the foundation has found critical to this vehicle, is that it speaks to your point, to the various levels, like starting with young people at the center. What is the information that their families need in order to help make the right decisions in the current context that we're in? So to Christine's point, again, it was about education. What's happening as schools close? What are the resources available so that parents who have now had to take on this task of becoming their child's teacher have the resources readily available, but also the information to know when might I be able to transition that role back to the classroom teacher. When you think about the health, at the beginning of the pandemic, we really didn't know how young people were affected by COVID-19. So being able to have the health department come in and speak to not just the larger issue of the impact of COVID on the community, but specifically how it was impacting particular populations of color, the youth population, and to Christine's point, parents being able to ask those critical questions at that moment. And then because it's a coalition, we've been able to lift up those organizations who have placed young people at the front. So 42 Forward who's one of the main organizers of this of the coalition, has a very strong youth organizing component. So they had at the beginning was able to really engage Dr. Vivi at Detroit Public Schools Community District and Dr. Vivi around the issues that meant something to young people. So I feel like that is a strength of the work, is that it isn't just a bunch of community leaders that are working outside of the populations in which they serve. We're bringing the voices and the feedback around what young people and what parents and families want to hear, and making sure that we're keeping it in front of them every week.
Yeah. Christine, talk more about the work of urban neighborhood initiatives and what you're hearing from people about their anxieties going forward.
So our organization, Urban Neighborhood Initiatives, but DHDC, Focus Hope, those are some of the collaborative members, Brilliant Detroit, Hope Starts Here. All of us have been listening and listening to our constituency. So for us, it's our residents, it's our parents, it's our young people. And I think while people really want, they want things to go back to normal, they know that it can't. And there's a lot of anxiety around how do you balance work and your responsibilities and have your kids at home, going to school at home. But it's also, if you have multiple kids, how do they all go to school at the same time when you have one computer or two computers? So, or you need to be on with one of them depending on the ages. So I think what we also have been hearing is the numbers going up is creating anxiety. And so I think that every week it changes, literally. People's feelings about it, but I think what people are longing to hear is what science says about it. What are doctors saying? What is public health saying? What is science telling us is the right thing to do right now? Not, we all know that the economy needs to open. We all know, what that causes for our families if it doesn't. We know the consequences of that. But I think this is a time of reckoning that our families, our grandparents, our parents, our kids' health is paramount.